working for you in the spirit of Arkansas. This is Channel 7 News. Good morning, Arkansas.
Dr. Rhys Branman is here. He's got something called Dysport.
Huh.
It involves an injection, but it's, I think that's the small part of it.
Yeah.
The results are what you're going to want to stick around and see. And maybe you don't know what Dysport is. It's coming up first.
Can't wait to learn more about that. Never heard of it before.
I know.
We'll talk with Rhys in just a moment. Coming up after the short break, we're going to tell you more about how Dysport, the injection, works. Dr. Rhys Branman's in to tell us more about that when we return.
Welcome back, everybody. Dr. Rhys Branman is here to tell us how Dysport works. Good morning to you.
Good morning.
Good to see you.
Man.
And you brought along a helper. This is Heidi.
Yeah, that's right.
Heidi, it's so good to have you here this morning, too. First of all, Dysport. I even mispronounced it earlier, but D-Y-S-P-O-R-T.
That's right.
What is that?
Well, it's considered a neuromodulator, very similar to Botox.
Okay, right.
Everybody's heard of Botox.
Sure.
Dysport's a newer version of that. One thing about Dysport that's very nice is it takes effect within 3 days as opposed to 7 to 10 days. So if you've got an emergency,
sure,
and you got to have that Dysport right away, 3 days, it's taking effect.
Okay, now how does it work?
Well, what it works is that we do small injections into the muscles, especially muscles of, expression. And what it does, it knocks those muscles down. It softens them so you're not making the lines and wrinkles that people see when you express.
And and that's what causes those wrinkles, right? Those muscles overworking, right?
That's right.
They're
overworking, frowning too much,
right.
So if you don't want to frown a lot, hey, Dysport's really right for you.
Okay, we have some before and after pictures.
Yeah, it's an excellent before and after
there.
picture where you can see the actually corrugators and procerus muscles. I know you don't want to know what those are, but they're flexing, and what they're doing is when they put the Dysport in, that's her flexing her muscles afterwards, and so you get a much softer, nicer look without the lines and wrinkles.
Looks beautiful. Now, is this something that will always be there? Then your muscles will be permanently slightly disabled?
Well, we used to think that, but actually the muscles are pretty crafty and they come right back. So within about 3 to 4 months, you need to have another injection.
All right, very good. And some people complain about something like a frozen look, like the inability even to make muscle or make expressions.
It's kind of a joke out there that you have a frozen look. You'd have to put a lot of Dysport in it. Most people can't afford that.
Okay, right. All right, and this is just a very shallow injection, I would imagine.
It is.
The muscles aren't very far below.
Yeah, the muscles are right underneath the skin. Very shallow injection. Very easily done.
Okay, and
we have a demonstration here
too. Let's go ahead and do that. We'll talk a little bit more as we do it.
And so Heidi graciously has decided to volunteer so that we can do some injections for her. We're going to do this glabella area where if you flex for us, Heidi, you can see that she's doing the exact same thing as those pictures there.
Right.
So what we do is we just wipe off that area with a little bit of alcohol like this. And it's really 5 little tiny injections that take no time at all. Really, and so you flex for me there. Good, that shows me where the muscle's in. You just relax now. And we'll do 1 little injection there. We do a little tiny injection here. I mean, this goes so quick, you don't even know it's done. And next thing you know, you're out the door and looking better already.
And that is a tiny, tiny needle.
And there we go. You hold that for me.
You know how I know that it didn't hurt?
She didn't move.
Flinch or anything at all. Okay, so it wasn't painful?
No.
Okay, all right, very good. Well, everybody's going to be beating your door down to get this. I mean, but how do you get it? I mean,
well, what you do is you call our office, you make an appointment, and we can get you in usually that same day or within a few days.
All right. So this is new technology.
It's new technology. It's a fairly new product, and there's, this has been ongoing for many years, and we really can use it in the face, eyes, and sometimes around the mouth for lines and wrinkles around the mouth as well. Okay,
and there were some pictures up there about what it looks like. What about the cost that's involved with this?
Cost is about $5 a unit. Typically, we'll use somewhere around 90 units for an area like this, 60 to 90 units.
Okay.
So maybe around $300.
All right.
Lasts you for maybe even up to 6 months in certain areas. We're offering a rebate right now, $25 off. So come on in and get it.
That
helps less expensive.
That helps out quite a bit.
That's right.
All right, so we want to put up your information on the screen there.
Sure.
But it's Cosmetic Surgery Center. It's out in West Little Rock at 10809 Suite 100 Little Rock, and there's the number for an appointment or a consult, anything you'd like to talk to Dr. Branman about, 227-0707, just one of the many things that he does out at the Cosmetic Surgery Center. You said, how long, again, will it take to go into effect, really? That she'll notice real results?
3 to 5 days.
3 to 5
and one
days.
thing I also mentioned is that Dysport's for dads, you know.
Oh,
You can also do
for
it.
guys too.
That's right. A lot of guys do it just for that subtle, you know, younger look.
Okay, I'll talk to you about that later.
Okay, I appreciate it.
Heidi, thanks for being here as well. And Dr. Branman, thanks for
seeing
being
you.
here.